Hi, my name is Ian Bostock. This is Skill Assessment 6 for Postural Analysis of a partner, which is mine is Josh Frankham. And we'll be starting with the frontal view. With this, first off, you want to make sure you have your patient in line with the plumb line, which there is a line that goes straight down their body. With ours, we used our door, and you can see that the line does go straight down Josh's head through his thoracic and then down through his pelvis as well. With this, we are going to assess first off Josh's head. You can see with Josh that his head is very in line. You want to make sure there's no rotation on either side or a tilt or a shift. With the front, it's kind of hard to see a tilt or a shift, but you can see his chin's in line, maybe a slight tilt downward, but anything serious. His head's not tilted either way or shifted, and there's no rotation. The next thing we want to look at is the shoulders. For shoulders, looking for elevation. For Josh, or depression. For Josh, you can see that he may have a slight elevation on his right or his left. You can see that his trap may be a little more elevated on the left side. The next area is rib cage. Here you can also assess the distance between the elbow and the ribs, or the body, of course. This is just to see if his arm has any carrying angle that may differ from side to side. But at the rib cage, you're looking for elevation of the ribs or rotation. And on Josh, you can see there is no elevation or rotation on either side. Something else you're going to assess in the rib cage and even at the chest and shoulder area is the nipple line on men. For women, you're just going to disregard this, but the nipple line, you can see that Josh does have a slight depression on his left side, which we should note in evaluations. The next area is the pelvis. With the pelvis, we're going to assess the ASIS, and you want to see if there's any rotation clockwise or counterclockwise. With Josh, you can see there is a slight elevation on the left side of his body. So you want to note that there's elevation on the left side. When we turn to the side view, you can see more of the line from the PSIS to the SIS on a slight side from Josh's left, or right side, I mean. There we can assess angles. At the knees, you will look for if they're in or out, if they're pointed in or pointed out. With Josh's knees, you can see that his left knee may be in slightly and his right knee is a neutral position. This could be from sports or other activity that have caused this. The next area we will look at is Josh's ankles and feet. You can see that Josh's right leg is everted out quite a bit. You can see that from the tape line at his medial malleolus, and you can see that his left ankle also, or foot I mean, also has a very slight eversion. Some people may be inverted, and what you want to note for those is both, and then even the neutral position. The next area of Josh's body we'll look at is the side view. With this, we're going to assess many of the same things. To start with the head, you want to look for forward movement or some retraction. For Josh, you can see it has a slight forward motion. The next area you want to look at is cervical spine. For the cervical spine, you want to look if it's kind of in. On Josh, you can see that it's a very neutral, so it's not flat or excessive extension. You can see that Josh is in a pretty neutral position. The next is thoracic spine, upper and lower. With the upper, you want to make sure that it is neutral. For them as a curve. So you can see that Josh is in a neutral position. There's no excessive curvature or any decreased extension, or decreased flexion, sorry. With the lower, you can see that it's also in the curved position, no excessiveness. The next is lumbar spine, which is in like the cervical spine. With lumbar spine, you can see that Josh may have a little bit of excessive extension there. It's not very flat, but it is in, and it curves in a lot more than you want it to. The next area assessed is the pelvis and hip joints. With the pelvis and hip joints, you're going to see that Josh's pelvis may have a slight interior tilt on at least his right side. There you can see that it is tilted anteriorly. Also, there you can point out Josh's hip joints that he may be a little extended. There you can also look at the line, an angle there 10 to 15 degrees from the PSIS to ASIS. Josh's angle when we measured it was about 10 degrees. So right there he's probably about average. There's really nothing on that side. His left side did show a slight decrease though. The next area we're going to look at is the knees for Josh. Josh seems to have a little bit of hyperextension. He's not very flexed, but he is a little hyperextended. there on both sides when measured. The next thing you're going to look at is his ankles. Josh does evert his feet a little bit, which causes a little bit of dorsiflexion, but most of all, he's in neutral position, at least on his right side. His left side had a small amount of dorsiflexion. The next area we're going to look at is Josh's back view. For here, we are going to assess the same areas as well. Starting at the head, we can see that it lines up very well straight down the line. The next area you want to look at is if there's any areas in the spine that curve in any way. You can see that Josh has a very straight back down the line. We'll then assess his humerus and scapula. So at scapula, as you can see, Josh does have a slight depression on his left side. The tape really didn't show it, but there's a slight depression on the left. You can look to see Josh's scapulas that are in line. You can measure the inferior and medial borders, which lined up very well. For scapula, they were neutral, no protraction. They were a little elevated on his right compared to left. The rotation, though, was very normal. No winging and no anterior tipping. With his humerus, you see they're in a neutral position for his right, or for his left and right. His left was a little more interiorly rotated, or medially rotated, which just shows that Josh's carry angle may be a little different on his left. For his pelvis, you can see the dots on the closer medially are his PSIS, which in the tape around, you can see his PSISs are both in line with each other. No rotation there. The next area we want to look at is his femurs, if they're straight or medial or laterally rotated. With Josh, you can see there's not a lot of rotation. Both are in line at a good level. And the last part, of course, is Josh's feet. You can see there, once again, Josh has eversion going out. His toes point out. Really no change in the knees. Once again, you can see if you look up the kinetic chain, though, into Josh's knee, that his right leg does come in just a little bit. It bows in, while his left leg is in a neutral position.